Greetings everyone, welcome to your favorite health show, Health Wealth, where we discuss all things health. It is indeed the Roman poet Virgil who said, your health is your greatest asset. Without your health, you may have huge sums of money in your bank account, you may have all the cars there are in this world, but you'll not be able to enjoy that without good health. If you are able to sleep well at night, if you're able to walk without pain, to eat your food and enjoy it, that's health. That's something to treasure. You cannot trade your health with anything else. I'm Dr. Alaisa Mbiriri. I'm a lifestyle medicine specialist with a special emphasis in preventive health. With me today is a guest. We are going to be talking about non-communicable diseases. We are starting an episode, a full episode on non-communicable diseases, and we want to find out what this monster is, what are non-communicable diseases, what are they, all the different types of non-communicable diseases. We are going to have this discussion, so please stay tuned. So watch out on our episodes which are going to come on Facebook, on YouTube. Like our pages, Hope Channel Zimbabwe. You will find this whole season on non-communicable diseases. Help me to welcome our guests on this show. Welcome.
Greetings to our beloved viewers. My name is Dr. Mchoza. I'm a government medical practitioner at Mvuri Hospital in Mashonaland Central in Zimbabwe.
Thank you so much, Dr. Mchoza, for coming to this show where we are going to talk about non-communicable diseases. This is our first episode for this season. So we want to understand what are non-communicable diseases. Maybe before that, what's your area of specialty and anything like that?
Okay, currently I'm a general medical practitioner, but my vision is to become a physician.
A physician. Well, may God be with you as this vision comes to pass. So let's just go straight to the discussion for the day, non-communicable diseases. Okay. What is non-communicable, a definition for non-communicable diseases?
For us to understand what are non-communicable diseases, we have to first understand the major categories of classifying diseases.
Correct.
So diseases are classified into communicable diseases and non-communicable diseases. The communicable diseases are those diseases that can be transmitted from one person to another through vectors like mosquito, through contact, through air, through water, and also through fecal oral route. While the non-communicable diseases are those chronic lifestyle diseases that cannot be transmitted from one person to another. For example, if I have my hypertension, I cannot transmit it to you. So the examples of these non-communicable diseases are hypertension, diabetes, strokes, heart diseases, obesity, and cancers.
Okay, all right. So thank you so much, Doctor, for explaining to us on these two major categories, communicable and non-communicable disease. So maybe for the sake of our viewers, for communicable diseases, I think we all know COVID-19. We went through the pandemic. So yes. COVID-19 is a communicable disease.
Yes.
Because you can pass it on to the person next to you.
Yes.
All the measures that you were doing, the social distance, the quarantining, all that was to prevent transmission to the next person. But now when you are talking about non-communicable diseases, these are diseases that you cannot spread
yes,
to the next person. You have this disease for yourself, to yourself, or whatever. It's your disease. So maybe that's where we have the term double burden of disease. What's the meaning of double burden of disease?
Okay, let me start from the geographical distribution of diseases. Back then, in Africa, Africa was a hub of communicable diseases, mainly. Because now, and also the Western world was a hub of these non-communicable diseases. So, because of changes in culture, changes in lifestyle, changes in diet in Africa, these non-communicable diseases are now more common in Africa. So Africa was still battling the communicable diseases, which were common in Africa, but now there are non-communicable diseases which are becoming more common than the communicable diseases. So it's now a double burden of disease, both in non-communicable diseases and communicable diseases, and making it more difficult to manage these diseases.
And it's quite unfortunate that we on the global south,
Yes.
we are still battling. You see, we still have cholera cases in
Yes.
some of our Southern African countries. We still have people who are dying from all these treatable, communicable diseases. People are still dying from them, maybe issues of even of immunization, some people, all that. And additionally, we have added chronic and lifestyle
yes.
diseases to the burden that our countries are facing. And we are also now talking about triple burden when we are including issues of disasters and climate issues. So we are now talking about, we now have a triple burden. We still haven't eradicated communicable diseases.
Yes.
In countries like in Europe, in UK, where Lord John Snow first cited cholera and they eradicated, they managed to do away with these things. But now we have this communicable, we have non-communicable, and we have climate issues which are adding a burden to us. So why is it important for us to discuss about non-communicable diseases in our context here in Africa, in Zimbabwe?
Okay. It is important to discuss non-communicable diseases, firstly because they are now more common in Africa. So let me start on a global perspective. So we see globally, non-communicable diseases are causing much of the disease morbidity and mortality. Like in 2021, it was recorded that around 71% of deaths that occurred in 2021 were due to non-communicable diseases. And heart diseases being on top, with a share of 13%. So this same global statistics is almost the same statistics that is in Africa, that is in our region, Zimbabwe, since these non-communicable diseases are becoming more common among us and causing much of the mortality and morbidity.
So indeed, we see that non-communicable diseases are taking a lead. You've mentioned that diseases. Which are the ones maybe in the top 10? Maybe not necessarily in the order.
Okay. In the top 10 of non-communicable diseases, those heart diseases which we have mentioned, and the stroke, diabetes, cancer, and the Alzheimer's disease, and also chronic kidney diseases.
And so are we saying these conditions, we are now finding them in Global South?
Yes, these conditions, we now find them in Global South, especially in our own country, Zimbabwe.
We now have people suffering from diabetes.
Yes.
We now have people suffering from heart conditions, cancers. And I think it's a pattern that we can now clearly see. Because if you remember, I don't know how young you are, how old you are, but it's now more common for you to hear someone who is stroked. Someone is they dropped dead. Somebody had hypertension and they died. Someone has been amputated, they had diabetes. You know, it's now like almost 1 in 2, 3 deaths you hear.
Yes.
It's a non-communicable disease.
Yes.
Why would it be like this? Why do you think there's been a shift? Because I think back then, when we were still young,
Yes.
we really didn't hear of deaths that much, or
Yes.
maybe because we were young or something like that. But it was not as the way it is now.
Yes.
That this one is cancer. We need to go for hospital visits. This one is breast cancer. This one is prostate cancer. This one, it's almost like everyone has one of these conditions. Why is it like that? What would you think is the reason?
Okay. To to the side of the world that we live in, back then, like you're saying, these non-communicable diseases were not causing much of the mortality and morbidity. And we were still fighting the communicable diseases. So because of change of lifestyle, change of diet, and a lot of sedentary lifestyle, which now people do, these diseases, since they are lifestyle diseases, they are now becoming more common in our setting because of the lifestyle changes that we adopted to.
Maybe if you can just explain to us what's the meaning of lifestyle. In your definition of non-communicable, you say they are lifestyle conditions and chronic. If you can just expand on the lifestyle aspect into the chronic part of it.
What we call lifestyle are things that people usually do on a day-to-day basis.
Our daily behaviors.
Our daily behaviors, like our diet, what we eat, and physical activity, and also what we mean by the term chronic is that these diseases, with no intervention, they are lifelong diseases, and they cause damage gradually in the systems.
Okay. So your lifestyle chronic conditions are your lifelong conditions which come about because of your behaviors. Thank you so much. We now take a break. We've been talking about this NCDs, what are they, the impact globally, and we've just realized that we have the 10 leading causes of mortality and morbidity. The leading ones are your non-communicable diseases. Thank you so much. Catch you after our break. Welcome back to your favorite health show, Health Wealth, where we talk all things health. I'm Dr. Laisa Mbiriri, and with me is Dr. Mchoza. We've been talking about non-communicable diseases. What are they and why we have these non-communicable diseases, looking at global statistics on non-communicable diseases. Before we went for the break, we were explaining on physical activity and sedentary lifestyle that people are now engaging in. Maybe to restructure that, let's just focus on the risk factors for these non-communicable diseases. What are the risk factors for the non-communicable disease? Of course, we had already touched on some of the issues, which include sedentary lifestyle.
Okay, so the risk factors of non-communicable diseases can be classified into two categories.
Correct.
So they are what we call modifiable risk factors, which we have control over and which we can change. And also which is also the more common one. And also the other is non-modifiable risk factors, those things that we don't have control over, like age, family history, and also race. But the common ones are the modifiable risk factors, which are the sedentary lifestyle, one, alcohol and tobacco, and the unhealthy diet that includes high processed foods with a lot of calories, and also that includes fats, especially the saturated fats is found in animal products, and that includes sugar and salt. And also the other risk factor is weight, being overweight or being obese.
Thank you very much for categorizing these non-modifiable and modifiable. Let me take you back to the non-modifiable. Where you're talking about age, you're talking about race and sex. Of course, if I'm a woman, I'm prone to breast cancer. We have breast cancer in males, but the highest percentage is in men. If you're a man, you're prone to prostate cancer. I will not get prostate cancer because I'm not a male. So when it comes to age, which age can we talk about is non-modifiable risk factor?
Okay, age above 55.
Okay.
I said 55. You'll be now at risk of getting these non-communicable diseases.
So if I am above 55, does it mean no matter what I do, I still have the risk factor? Even if I eat healthy, if I eat what, because I'm 55, I'll get the condition. What does that mean?
It does. It's just a risk factor. So if you have a risk factor, it doesn't mean that the disease you'll get the disease. It's just a risk factor. You are at risk, at a risk of getting that disease. If you subscribe to a good lifestyle, good physical activity, and good diet, you might not have these diseases, despite you being at the risk of getting such a disease. Yeah. So the non-modifiable risk factors, they load the gun.
Correct.
But then what will pull the trigger is your lifestyle and your diet.
Why is it important that we talk about diet in the context of non-communicable diseases?
Okay, so firstly, the first principle is you are what you eat. You are what you eat, because if you take in food, it's going to be digested, and then will go to the different systems of the body. So unhealthy diet, firstly we have processed foods, processed food that lack fiber. So these processed food will cause uncontrolled regulation of sugar in the body, and you'll be at risk of getting diabetes. And also we have things like fats, the saturated fats, like those we get in animal products, and some oils like butter. Usually those are oils that are solid at room temperature. So these are the saturated fats. So these are going to increase your weight, and also increase your calorie intake, that can result you to become overweight or obese, increasing your risk of getting these non-communicable diseases. And we also have salt.
Yeah.
Yes.
Maybe before we go to the salt aspect, I've always said this to people who care to listen to me when I'm talking about fats is, the fat that you talk about that is solid at room temperature. You will cook your meat in 100 degrees water.
Yes.
And it is a fat which is there, like it's coated, it's marbled. We call it marbling, where the meat has got fat surrounding the steak. This meat is going to be boiled at 100 degrees. The water is at 100 degrees. So you're putting in an oven, which is at 180 degrees, 200 degrees Celsius. The fat will still be there even after 30 minutes. After 1 hour of cooking, it's still there. And you're putting it in your body. Which is way less than 180 degrees or less than 100. There is no rocket science or no miracle which is going to convert that fat, block of fat in a body which is at 36.5 or 37 to something healthy. Your body is not going to have a miracle of converting that unhealthy fat into a healthy fat when it gets into your body. When we are taking this fat, it's something huge.
Yes.
When linking it to non-communicable diseases, because some people just think, oh, okay, maybe if I get fat. Here in Africa, if you are a married woman, maybe the rounder you are, the better. Or the better you are, the better. That's how people will see that, oh, now this one, or this one is now sitting pretty. But unfortunately, it's linked to these non-communicable diseases. And maybe what's your word to us? Because we also look at our African bodies are big, or no, you can't compare us, to people who are slender by nature, and we want our our bodies big. We want to see that no, doctor is now a doctor. He is now enjoying his money when we see you with this belly and these cheeks. What would you, what's your say about that?
I would say that the bigger the body and the bigger the belly, the more risk to these non-communicable diseases. Yes.
You know, we now talking about multi-morbidity. Like when we used to say maybe comorbidity, but now multi-morbidity, where all these conditions are existing. And maybe not necessarily that it came because of this, but they are coming on their own to you. You now have your heart disease, you have your cancer, you have your kidney disease, you have, and they are linked to this unhealthy lifestyle. Yes, let's move on to the third one that you were talking about, maybe tobacco.
Okay, so yeah, the other risk factor for these non-communicable diseases is smoking, especially tobacco. Yeah, so tobacco smoking is linked to a lot of these diseases like hypertension, diabetes, and lung cancers, and many types of cancers in the body. So, and also the other risk factor, which is similar to tobacco, is alcohol intake. Again, it is linked to many of these non-communicable diseases, diabetes, hypertension, and kidney diseases, and also many cancers in the body.
When you're looking at issues to do with alcohol intake, there are proponents of you taking a glass of wine a day to spare yourself from heart disease. What do you have to say about this? Because people will say, no, if I'm drinking moderately or if I'm taking a glass of wine, because there's this study which showed that some little alcohol will be whatever. What do you have to say about that?
I would want to say to be safe. To be safe, just stay away from alcohol. You can't take a devil because it's a small devil. You see, you get what I'm saying? A devil is just a devil.
Yeah, yeah. I think you have said it well, that a devil is just a devil, no matter how small or big. When you are looking at, because I've always argued that when you are looking at, people will say, "Let me take wine." The components that you are getting from wine, you can still get them from grapes.
Yes.
So you are safer when you are taking the grapes, because what you are getting from the wine is resveratrol, which you still get in your grapes.
In your grapes.
So you can get you can eat your full bunch of grapes and get that protective components which will protect your heart.
Yes.
So I think it's best we stay away from this devil called alcohol, although it's on the increase even among Christians, among Adventists.
Yes.
You find in our Adventist health study, which was done in the US, one of the biggest health studies that have been funded by the US government, it's surprising on the number of people who are now taking alcohol. Even from conservative communities who previously didn't take alcohol. Maybe your last words when it comes to non-communicable diseases.
My last word is about prevention. It's better to prevent these diseases than to have a long-time management, which will cost you financially and it can cause premature death and can also cause a disability. So it's much safer to take a good and healthy diet, to do physical activity, and to abstain from alcohol, and abstain from smoking, and doing some weight management.
Yes, there you have it from Dr. Mchoza. When we are talking about non-communicable diseases, we are saying prevention is better than cure. See you next time.